Good morning, everyone. Can you hear me?
Good morning. Yes,
Yes.
Arnel.
Morning, yes.
Hi, how are you doing? I'm very happy. Some of you have started their assignments already, so most probably everybody will get in time. Okay, so we have a new topic today: consciousness, sleep, and awareness. All right. I think this is something new. Before we are going to start, I think we have to wait for just 1 more minute to allow others to come in to join. Okay. So before anything else, I would like to get your general opinion on your understanding about the topic. Anybody would like to tell me their understanding on consciousness, awareness, or sleep? Any of the three that we are going to start discussing today.
I will do consciousness.
Okay, so I'll appreciate that. Will you please do so? Thank you. Go ahead.
So, consciousness is the person being awake and aware of like everything happening around them.
Okay, very good. You can expound on that.
Excuse me? Excuse me?
You can give any example on that.
Like, for example, us in the university. We are awake and we know what is going around us. We attend our classes and we are aware what is happening.
Are you sure in the university you are awake and aware what's happening inside the classroom?
Of course
No,
we
just
are.
it's just a
Of
joke.
course we are. Oh my God. Oh, maybe here in houses we are not conscious,
Yeah,
but in
yeah,
Amy, I believe we are. Yeah.
yeah. I always start a joke like this in the classroom, especially when we discuss about sleep, no? Sleep
Yeah.
consciousness, you
We go
know.
yeah, we go to that state.
Yeah. Okay, thank you. Anyone else? Sleep or awareness? Can you cite to me what would be the most important or the relevance of this topic in psychology and in nursing? What do you think? Why is it that this is very important to be discussed in the class?
Can I answer?
Sure.
Because it is necessary for all human.
Okay.
Okay, and I don't know what I say.
No,
I
no,
need
go
to
ahead.
say
Come
again.
on. You have an idea. No, no, no problem. Necessary
Uh,
for all human. You started that. Yes. You are very close. Go. You may expand on that further.
and also sleep means that unconscious. That mean the human and internal body organs and other things needs to rest.
Okay.
So human should be consciousness, and also be consciousness that mean awake and
Okay.
considering something. Sleep, it means to take rest.
Mm-hmm.
Awareness, I think, to be careful of what is happening around us,
All right.
to
Very
consider
close.
about it.
Can
You're
I add
correct.
something?
Yes, sir. Rama. Yes.
Uh, so as you said, of course, it's like human nature. This is number one. Like this is the basic target. The second thing is uh, when we know the levels or when we know the definition of consciousness, we will be able to differentiate the levels of like people. Like for example, we will be able to know how to deal with people according to their consciousnness. How do they understand? Yeah.
Yes. Especially in the context of nursing, consciousness is actually very important, no? So we should know what is the meaning of that medically, no? But in psychology, I'm going to tell you honestly that the psychology of consciousness and awareness are two very big terms that we are still trying to study until now. Because as you could actually see, initially we discussed about the dichotomy between mind and the brain. And we would always actually say that consciousness is the function of the mind, and the mind is always separate from the brain. So usually this is very difficult to explain. There is no context that yet agreed upon by psychologists, no? But for the meantime, in consideration of nursing and in consideration of what we are tackling right now, we are going to look into the context that we are supposed to study under nursing curriculum, right? This is very important because most of the time we're actually looking into the consciousness as a measure of awareness on what's going on in the environment. Consciousness is also looking into the current perception of something within the environment. In short, all the organs of perception and sensation must always be working together. That means to say that person is alive, no? So this is pertaining to the vital signs that we're looking for. Anyway, we'll go ahead and discuss about that as we go on. But to go deeper into the context of consciousness and awareness, it will be very difficult to explain also. In fact, there are so many psychologists who are trying to study the consciousness. Most of the time they would always look into metaphysics, into something that is actually beyond, because they're always telling that there is a separate entity of what is physical and what is not physical. We call it metaphysical. Anyway, we will not dwell on that as we go on, right? Now, if you're going to look at a picture, what can you observe? This is my favorite, you know. That child is very cute, isn't it? What is the child doing? Anyone?
Sleeping.
Sleeping. Okay, so let's try to contextualize that based on our topic. Is the child, when the child is sleeping, is the child conscious?
I don't think so. No.
Is the child aware of what's going on?
No.
No.
Okay. Now, in the language of nursing, when the child is not aware about what's going on, when the child is not conscious about what's going on around him or around her, therefore, in logic, the child is dead. Is it? Come on.
Doctor, can you repeat what you said?
Now, most probably all the time we are equating that a person is not aware. If a person is not conscious, then we can always assume that that person is dead, right?
Yes.
Can we assume that? Now, if you are going to observe the child not conscious, not aware of what's going on, is the child dead? Look at the picture closely. You use your knowledge in nursing. Yeah, is the child dead or not? Look at the skin. Look at the color of the skin. She is very cute. Or is the child alive?
Alive.
Alive, right? Because observing the skin is actually oozing with blood, no? Because the child is reddish in a way. Now, we are going to look into that. That's the reason why I contextualized our topic into three contexts. That is sleep, consciousness, and awareness. You know, we have to differentiate between the context of sleep, the context of being alive, and the context of being dead. In fact, we are using the language of consciousness into looking if the person is dead or alive. Particularly as of now, no? Every day, we encounter people who are admitted in the hospital for, let's say, TBI, traumatic brain injury, or caused by any vehicular accidents. Now, the challenge is if the patient is actually admitted, therefore, the patient could actually be breathing, or the patient or actually is dead. We are going to look into the state of consciousness, right? So we always associate the state of consciousness with being alive or with being dead. Now, we are going to look into what's wrong. We are going to look into our specific judgment. We have to judge, we have to consider if the child is alive. We have to assess the consciousness of the patient in a way, looking into different tools that we can actually use. Now, most of the time, medical personnel are dependent on GCS. We call it Glasgow Coma Scale. This is used to assess patient's level of consciousness. You see, now Rama and Mariam and I think define consciousness for us as something like becoming aware or perceiving things around them. Now, this is totally correct because we are always associating that consciousness is actually simply meaning you are alive, the person is alive. Now, if the person is without consciousness, the person could be dead. So we would always look into that. That's the reason why we have to assess the consciousness level of the patient. And we have to find out if the patient is dead or alive. This is actually to determine if there is brain damage. Now, the problem is, if you are sleeping, do you really assess? Can you really assess the consciousness of a person using GCS? Are you familiar with GCS on the first place?
No.
Okay. This is one of the neurological scale that we are going to use in order to assess the consciousness of a patient. The highest score is 15 and the lowest score is 3. All right. If your score is 3, the lowest, you're almost dead. We call it your brain damage. If you are fully conscious, then you are actually alive. 15. No? So you will encounter this, I think, in your neurological disorder subject that will be next year. But for now, in the context of looking into consciousness, you see, we can differentiate a person who is actually sleeping and a person who is seemingly sleeping, but there is an injury. That's the reason why we are always calling their names. We have to make it sure that we have to stimulate their senses. That's the reason why we are going to call their name when we are going to assess. Yeah? Can you hear me? Something like that. So they will respond definitely. If you're sleeping, you are going to be stimulated, you're going to reply, or you're going to respond. And also, we are going to assess your feelings, no? Your sense of touch. That's the reason why you can differentiate a person who is sleeping and a person who simply is seemingly sleeping, but totally in coma. That means to say no capacity to wake up. Maybe in time, yes, but for a few months or for a few days, the person may not actually wake up. That is actually the importance of that. That's the reason why we will assume as nurses to be that a person, when we are going to use GCS, may be assessed in terms of the levels of consciousness using this tool. No, we're going to look into the sensation of the patient around us. They sense things. So how do we assess the sensation? Of course, we have to assess the sense of hearing, the sense of touch. We're going to assess also the reaction of the patient to the light. Yeah. Now, this is actually difficult. It needs exercise because you need to spot whether just a person is actually sleeping or not. We know for a fact that we see a person unconscious on the bed, probably the person is sleeping, isn't it? But when you see someone seemingly sleeping along the road, what can you assume? There is a big difference between the two, right? You get my example? Now you are going to exercise your sense of judgment, okay? I need an answer here. When you see a person seemingly unresponsive and unconscious on the bed, what can you assume? The person is dead or alive? Or the person may have encountered accident or not? Anyone here?
No, he'll be alive.
Yeah, the person is just sleeping, right? Now let us try to look at that in different contexts. You see a man seemingly sleeping on the road, of course outside the house. What can you assume? The person is dead or the person is alive?
The person is dead.
The person is
Could be
dead
both.
or could be both, isn't it? That's the
Yeah.
reason why it's very important that we have to know how to assess. We have to find out. That is actually our job. So basically, it's our call to assess, to find out. On the bed, there are also cases that the person is dead, isn't it? Because they died in their sleep. So when they are unresponsive, that will be the time that we are going to proclaim that they are dead. Therefore, we have to assess them all the time, isn't it? That is our obligation. That is our duty. How do we assess that? By simply stimulating the sensation. What are these sensations? We're going to discuss that in the next topic. Senses, sense organ. We call their name. We open their eyes. We touch their skin, isn't it? So we would like to elicit reaction. If there is no reaction, then there's something wrong. If there is a reaction, then the person is just in suspended consciousness. That means to say the person is just sleeping and the person is alive, isn't it? So it's very important that we have to look into that. It's very important that we have to assess. You should know that it's your call. You cannot just actually proclaim that the person is dead or that the person is still alive. You have to assess. We cannot assume that. You see, there are so many cases like that that they assume that the person is sleeping on the bed. The person is seemingly sleeping intensely, in deep sleep for quite some time, but they do not know that the person is already dead. You see, so you have to check if the person is still breathing, if a person is still conscious, if a person is still responsive to whatever stimuli that you're going to have. Actually, you can do mini check, mini GCS check at home. You can do that all the time. There will be a time that I'm going to teach you about the GCS, no? To determine the level of consciousness of a nervous person poses many questions rather than answers. So it will be very difficult, even among us, no? Since up to this time, the conditions that define consciousness are not clear. In psychology, it will be very difficult. There are so many debates pertaining to this. But in medicine, it will be very easy. If the person is responsive, then the person is conscious. If the person is not responsive, then the person is unconscious. The next thing that we are going to determine if the patient is conscious, that we are going to find out if they are dead or alive. So that's actually very clear using a specific tool which we call Glasgow Coma Scale. All right. So moving forward, in determining the levels of consciousness, we have to look into the following levels. Now, conscious, right? Patients are said to be conscious when you are awake. That means to say, you know what's happening in the surrounding. You are aware or you are alert. I believe your teacher in your fundamentals of nursing in your foundation taught you about how to ask the simple question in order to assess your patient's consciousness and awareness about their environment, isn't it? What you usually ask when you ask the consciousness of the patient about their environment. Have you tried asking questions to your patient? What kind of question do you ask?
Like, what is the date of today? Or what
Very
is your
good.
birth date? What is your
Very
birth
good.
date? What
Yes.
is your name?
Yes. But normally we ask what is the day today, and we are actually going to ask what is the time today. You see, you get the point because these are very basic things. You could be awake, but you could be confused also in terms of the time, isn't it? Particularly the recognition between morning and the afternoon. So there is a big implication. A person may be awake, but not aware. That's the reason why we have to be very careful in asking about this. We always make this in our report, particularly in our nursing process, isn't it? No, the person is awake, conscious on his surrounding. So you have to ask, what day is today? What time is it today? And you're correct, Rama, when you mention about if you're going to look on the memory, you will ask about the dates of their birthday. Yeah, something like that. No, so becoming conscious is becoming awake and aware or alert about what's going on around them. No, you know really what's happening in their environment. They're aware of their location and the time. So you know for a fact the patient is alive because they react to your question, they answer your questions, and they're breathing. That is actually the meaning of consciousness, of conscious. You see? So another one, of course, is semi-conscious. This is actually different from unconscious. This is the state of where you are reduced. Your wakefulness is actually totally reduced. Sometimes we call that clouding of consciousness. Have you experienced this? Semi-conscious. Anyone? In the class, maybe? After Dr. Arnel's class, in the classroom, maybe around 10 minutes before dismissal, what's going on? You feel so sleepy, isn't it? Sometimes you are hallucinating, no? You are something like dreaming. You are awake but not awake. Yeah? Have you tried this? At night
Yeah.
also. Very good. In the class, I know.
Like there are some like very boring classes. Very boring classes. Wallah, I feel like I'm taking a nap. You know, it's ugh.
You could
Yeah.
hear something. Yeah, you
Yeah, I
could hear
can hear
something.
something, but I'm not fully conscious of like what is happening.
Okay, you know what I'm talking about then. When you're watching television also, isn't it? When you have been there for a while, what would you feel, especially at night time? No? You are awake but not awake.
Yeah, like half awake, half asleep.
Exactly. So you are in the state of clouded consciousness. This is actually semi-conscious. You see? So you know what I mean, no? You could easily be awakened here. You could easily be stimulated in a way. When they call your name, when they shout on you, certainly you will be awake. That is the meaning of semi-conscious, okay? Now, the next thing, of course, is unconscious. This is actually very crucial, no? Because we can declare a person is dead or not, no? So when a patient is not responding to stimuli, it's very dangerous, because sensations may actually be impaired. There is no visual response to the passing of a pen light. You open the eyes and there is no response. You know for a fact that when you pass an eye, a flashlight on the eye, what would be the normal reaction? Have you tried this in your vital signs? When you pass a light on the eye of a patient, how would the eye reply? How would the eye respond? How would it respond to the light?
The pupil constricts.
Okay, it will constrict, right? That is normally what you're going to look. No, you should know the normal size of the eye, isn't it? The it must constrict, no? But if there's no constriction, then there is no certainly reaction. Therefore, there is a danger in that case, no? There is no verbal response when you're going to ask them. There is no motor response when you're going to stimulate, particularly the toes, no? To tactile stimuli. Sometimes you're going to use pen or any sharp object. You use the patient to feel pain, but the patient may not react, no? And in that case, he or she is said to be in coma or in an unresponsive state. You have to decide whether the patient actually is still alive or not. So this is actually very important, no? So these are the three levels of consciousness that the nurse may actually have. We are always assessing this every single day. When we go to the ward, that's the first thing that we have to look into. That is the first thing that we have to record. You see, conscious and unconscious. Do not place in the record unconscious, because this is a very dangerous one. Not unless you are sure, not unless you have checked. Do not just mention that the patient is unconscious. You see, because the next thing the doctor will ask you is that, did you check on the response of the patient? Did you check using GCS? Did you check the neurologic response of the patient using the GCS? So it's okay to place conscious, but unconscious, you have to be very careful about this. No, you have to qualify. The patient is unconscious. The patient is unresponsive to light, unresponsive to tactile stimuli, unresponsive to verbal command. So most of the time, these are the things that you are checking in the GCS. So you try to be very careful about this. I know you are already starting to record. You are recording already. So you are basically acting like nurses in the ward, no? Now, assessment of the patient's level of consciousness is very important, particularly in the nursing care, since the design of the nursing care plan for the delivery of quality patient care is dependent on this. We have to look into this, no? If the patient is actually unconscious, that means to say unresponsive to stimulus, but alive, what are we going to do? You have seen patients like that in the geriatric ward. What are you going to do? What are you going to plan? You have to plan for your nursing interventions. That means to say you have to fully clean the patient, you have to fully care for the patient, you have to fully nourish the patient, because the patient will be very dependent, no? Because the patient is not dead, although unconscious. So you have to look into this, right? If the patient is sleeping, so definitely do not disturb, do not do anything. So that's actually the implication here. Now it takes skills to be able to make the right assessment. Really, as nurses, you have to be very careful in looking at your patient, declaring them to be unconscious. You see? So that you, as nurses, to be can effectively design nursing interventions. Moving forward, let's try to look into a little bit philosophical in nature here in our discussions. No, there are 7 states of consciousness that we know of. The first one, medical consciousness. So let's try to look into the 7 states of consciousness. No, further in understanding consciousness. Now, medical personnel must always remember that the patient are human beings like themselves. We are humans. Therefore, we could actually be conscious about everything around us. I'll give you why is it that we are the same like them, no? They are continuously going through experiences that provide awareness or the presence of consciousness on that particular moment, on that particular time. Let's try to look and review this state of consciousness, no? Hunger, a little bit philosophical, no? In nature. What is the meaning of this? You have awareness and perception of what's going on in time, not only being aware of, let's say, the surrounding, being aware about the appearance of the sun, or maybe if there's appearance of rain or cloudiness in the sun. It's not always like that. It's also a state or condition that a person may have on that particular moment. So we should be conscious of what's actually happening around us, what's happening inside us. No, hunger denotes something. This actually is the lowest state of consciousness that an individual can attain. That's the reason why it's very important that you're going to fast. No, in your fasting, you're going to look into this. You see, the only people who really know what hunger is are those who have experienced it. When do you know? When are you conscious about being hungry? What is usually the time that you are actually encountering this or practicing this? You're very lucky, you know. If you belong to Islam, once in a while you practice this, at least once in every 1 month in every 12 months, isn't it? What do you call this? Fasting?
Yes, Siam. We call it Siam.
Ramadan.
Yeah,
during the time of Ramadan, everyone is, you know
fasting.
what is fasting. You know what is the importance of this? You see, there is implication in the religious aspect. There is also implication in the personal side. There is also implication in philosophical and psychological consciousness, isn't it? What is actually the nature and importance of of knowing that you are hungry once in a while? What can you deduce of that? But this is the lowest state of consciousness that a person may actually have or may actually have experienced. So how would you feel or how would you think that this is actually very important, no? To you as a person? Hunger. Is it? Uh, as a person, if you are going to be on this level of consciousness, we should know the feeling of any other person who is not eating for the entire year. For month, we experience that. From sun up to sundown, we do not have any food inside us. So what do? We have to reflect. We have to look deeper inside us. So in that case, that looking inside us will be converted into religious awareness. We should know what's going on. In that way, we should know about how people feel, and we should know also our relationship to God. That is actually the meaning of it, no? We place importance on this one so that we will know the importance of not having enough, so that we can understand other people. Imagine this, you see, you want to eat, but you are not supposed to eat. You have something to eat, but you are not supposed to eat. What about those people who want to eat, but have nothing to eat? You see, you will actually be in connection with them. Now, those people who are fasting may always feel about these people who want to eat, but have nothing to eat. Right or wrong? Have you encountered this? You know what I'm talking about? Our brothers and sisters in Yemen, for instance, there is a continuous war there, right? And hunger is always prevalent there. That's the reason why government of UAE is actually giving aid. You see, if you really would like to eat but have nothing to eat, most of the time you feel so desperate. As a human being, we should actually encounter their experiences so that we will understand how to be hungry. We will understand their frustration. We will understand how they feel so that we can actually help them. That is the relevance of hunger as a state of consciousness. You see, everybody must feel this. Everybody must have this. That's the reason why in Christian religion, one of the seven deadly sins that we are always telling is gluttony. You know, gluttony, eating too much. See, we eat and eat and eat. That's seven deadly sin. You see, you think that you're adequate, so you have to eat a lot without thinking about the needs of others. And sometimes they do not fast, although they are required to fast. People are like that. So they may not actually look into the hunger of other people. But for Islam, you are required every month, every year, to have 1 month of fasting. That is during the time of Ramadan. So that I believe the basic purpose of this is to really feel, not only to purify your soul, but is to really feel how or what are the feelings of others. Other than that, we can actually purify our soul and deeper our religious belief. All right? Now, the next state of consciousness that we know of is basically subjection, becoming dependent, becoming a follower. No? So we have to follow. Not all the time that we have to be at the top. There must be some leader that will actually arise. No? All individuals are influenced by the emotion of subjection. Become a follower. You know? Some people are forced into thought to be in this state or the environment. No? For example, the bigger government grows, the more people become subjected to its control. Basically, in a kingdom, like in the United Arab Emirates, for instance, particularly in Ras Al Khaimah, our ruler is the sheikh. In the Western culture, we call it ruler as king. Now, the population in that kingdom are called subjects. So, what do you mean by that? We have to abide, we have to follow the rules, we have to follow the regulations imposed by the kingdom, by the king, by the leader. So, every one of us must always think that some way, one way or another, there must be people who are above us. We are not always above. Even though you are already very, that's the implication, this one. Even though you are very successful already, like those people who have already reached, who already reached the peak in their practice, in their profession, they have already lots and lots of money, all cars, all things that need are always there. If you recognize the fact about subjection, if you recognize this as state of consciousness, you will realize that there are people above you and there are also some people below you. This is actually the meaning of this. Recognition that you are a follower of someone, a recognition that there is someone who is leading you, that there is someone who is way above you. That is the implication of this one. When you are in Ras Al Khaimah, the rule is imposed by the king, the sheikh. When you are in the United Arab, when you are in the United States, you have to follow what the president actually is asking you to do. See, in the form of the law, in the form of the law that they are actually imposing. That's the reason why there are policemen all over. This is the meaning of subjection. Therefore, we have to be very humble. We have to be. You have to think that you are not always on top. You know, sometimes they're always telling. There is a saying that goes, "Life is like a wheel. Sometimes you're up, sometimes you're down. But most of the time you're down." This is the meaning. Always feel that life is like that. No, you follow other people also. Even though you are already at the top, you still follow. That is the meaning of subjection. Coming from the word subject from a kingdom. So that's subjection. All right? Fear is another one. This is also a type of emotion that we should know of. We'll tackle about this, we'll tackle psychology of emotion. But fear is one of the seven states of consciousness that the person may actually encounter or experience. No? Human beings are ruled as well as motivated by fear. Most of the time, our actions are motivated by fear, no? Take note of this. You encounter this every day, including in the hospital where you go. There is a saying that goes, once that you enter the hospital, there is a 50% chance that you are going to die. There is 50% chance that you're going to live. It's 50-50. You see? No one will tell what happens really to you, what will happen to you. If you're likely that you are getting out alive, then thank be to God. Right? Thank you, God, for that. No? But if you are actually getting out there, or you see you're dead, then you could be upset. This is actually the one that we should know. No? The moment the patient actually enters the hospital, they would always encounter fear. They would always be afraid because they do not know what's going on. This is in differentiation with anxiety that they may encounter. Anxiety is a short-lived, but fear is the reality that the patient may face. The patients who are admitted to the hospital for surgery, for instance, are not certain about the outcome of the operation. See? Simple operation. You do not know if you're going to get out from the operating theater dead or alive. Right? So that is the meaning. What about us? Applying to us. We should always be conscious and aware of our fear. We should know that we are inadequate in a way. We should know also that we are actually giving in to our fears. Human as we are. Every day we encounter this. Okay? Particularly fear of the unknown. Our personhood is threatened. Our humanity is threatened, no? But fear is actually useful in a way. The next state of consciousness is intellect and emotion. Every person must actually have this. Recognizing this state of consciousness will provide you with a basic understanding of emotion and intellect, right? So when patients understand their medical conditions, what do you think will happen to them? They will feel so relaxed because they know, right? The emotions will always follow. Says they could actually feel happy, they could actually feel so sad, no? In the context of COVID-19, in the context of the pandemic that we are actually encountering right now, people do not understand what's going on. Nurses and doctors do not understand what's going on. We may be equipped with knowledge, but our knowledge are all inadequate. What more for the people who do not understand anything? So they are always afraid. They do not know what's going on. Definitely they are sad. You see, people will let go out because they're afraid of what's going on. Because they do not understand what is happening around us. That is the meaning of the basic consciousness called intellect and emotion. The more you know, the better it is, the better you are aware and you are actually perceiving the community around you. See? The more you will be relaxed, the more you're going to feel happiness, the more that you're going to feel joy in you, if you know what's going on. That's the reason why we are always emphasizing this. As nurse, when you go to the hospital, one of the basic fear that the patient will actually feel is that they do not know what's going on, what's going to happen to them. The first nursing intervention as nurses is that you're going to connect with them. How you're going to connect with them? Because you know that you are going to have what we call as nurse-patient relationship. Now, when you establish that, you are going to open up their mind. You are going to educate them. You are going to increase their understanding of what's going on in them. You have to explain the disease process. You have to explain their condition. The moment they know, the moment they're enlightened, then they will feel relaxed. Therefore, they will be very happy if they know that they can get better as soon as they can. This is the meaning of this. The more that you know, the better it will be, the better your understanding of the environment. So therefore, you could actually react accordingly. See? So basically that's the point. But the more that we do not know, the more that we feel unhappiness. That is the meaning of this fourth state of consciousness. Now, the next state of consciousness is logic and reason. You see? And every day, lives that we are living, in every interactions that we are making, in every conversations that we are initiating, see, logic and reason must always come into play. We use reasoning and logic every time we reason and think. See, not faulty reasoning, not a faulty justification. The mind is the ultimate basis of intelligence, no? So you have to be you have to know what's going on around you. You have to know the process fundamentally. The mind and intelligence are the sources of the intellectual faculties that you may possess, no? Including skills, knowledge, and decision-making capability. Now, the reason why most of the time we have difficulty deciding is that we do not use our logic and reason. See, we decide immediately. Then before we know it, we are regretful. We are regretting our decisions because we did not use logic. Because our decision is based on a spur of a moment, impulsive decision. Do not do that, no? Especially in nursing, when you're going to have impulsive decision, you may cost the life of your patient. Do not just jump into conclusion immediately. You have to make it sure that you have to assess. Therefore, you have to make it sure that all the necessary data are actually there so that you can make complete assessment, so that you can actually come up with reasoning. Now remember this, when you are actually doing your nursing process, there is a column that says rationale. Rationale is reason. The reason why we are going to place that because we need to be conscious and aware on what we are going to do. We will not place anything there that we do not know of. Like for instance, you found a problem. Definitely, we are the only profession who looks for problem. We look for a problem. Therefore, we make diagnosis. After that, we are going to make nursing intervention. The nursing interventions must be placed there with reason. That's why we, in one column, we call that as rational. Okay? Always take note of that. We do things in accordance to reason. We move things in accordance to reason. We perform things in accordance to reason and logic. That's basically the point. We should be aware, we should know about what's going on around us. That is the meaning of logic and reason as the one state of consciousness. Another state of consciousness that we know of is divine reasoning. That is metaphysical reasoning. Now, in the religious dimension of care, medical personnel must always consider the religious belief of the patient. Remember this. When you are going to interact with the patient, when you're going to admit the patient and interact with the patient, forget about your religion. Always take note of that. That means to say, we do not look into the person as if they belong to a specific religion, Islam, Christian. We do not look into that. We are going to treat that person as a part of a human race. As nurses, we do not look into religion, we do not look into their gender, we do not look into the different culture where they belong. We have to look into the humanity of that particular person. Now, what's going on here? We will not impose our own religious belief to the patient. We must be aware about that. You see? We know for a fact also that there are actually people who come to the hospital full of religious awareness. Sometimes they're always saying, this actually happened to me because God gave this to me. See? So you have to respect also that particular belief. No? Now, I'll give you some very basic example that we are actually encountering a lot of problems, particularly in blood transfusion. You see? Blood transfusion is necessary. Right. But there is one religion who does not subscribe to this. The person is dying because the person is losing a lot of blood. Maybe the person encountered an accident and there is bleeding. So the immediate thing that you are going to do is to stop the bleeding and introduce whole blood. But the problem is the patient may not accept the whole blood in the context of religion. What are you going to do? And this is actually a part of a long debate that's actually going on in nursing ethics, medical ethics, and religious ethics. So what are you going to do in that particular case? Have you encountered a patient like this, class? About the patient refusing any treatment? Maybe yes, no?
Maybe I heard about these stories, but I've never like seen someone by my eyes, or I've never worked with someone like that.
Very good. Now, anyway, there are people who refuse treatment, and that's the right, no problem. What if the refusal means life and death? What are you going to do? Like, for instance, you know for a fact that without blood transfusion, the person will die, isn't it? What do you call the condition when a person is losing so much blood volume? The person may actually go into shock. We call it hypovolemic shock, isn't it? The amount of blood that is actually lost is so much. So the patient may go into shock. After a shock, the patient may die. Now, you know for a fact that the religion of that particular person is that religion that forbids the taking of blood transfusion. What do you think? What do you know? So these are some of the contexts that we must be aware of. No, we do not just impose our religion, our religious belief to our patient, but always we have to explain this. No, because in divine reasoning there is a reason for everything. You think we are always looking into that. No, God is great all the time. God imposes this to me. God wills it. That's why we're always reasoning, inshallah, isn't it? If God wills it. All the time, God's will it. God wills it. So this is the meaning. But in this context, as I mentioned to you earlier, I do not know, for me, no? I have to call the attention of other doctors and we have to discuss what will be the implication of going or not giving or giving the blood transfusion. Then we have to decide. Because if I am going to decide alone, I may be in trouble. You know why I may be in trouble? Because I may be sued of not respecting religious beliefs and I may pay. The court may actually ask me to pay so much damages and that will be a big problem. But of course, we have the responsibility to keep the patient alive also. So these are some of the ethical considerations that you may actually have. You have nursing ethics now, right?
Yes.
Oh, you see, these are some of the most difficult decisions that you're going to encounter. How are you going to judge? You see, divine reasoning is one of the state consciousness that we actually have to have. We have to be aware on what's going on around us. See, there are so many ethical considerations that we have to look into. You see, another one other than divine consciousness is the cosmic consciousness. If you're familiar with cosmos, no? Yeah, the physics of Stephen Hawking. Stephen Hawking died a few years ago, but he's one of the most famous cosmologists, UK, no? British cosmologists and theoretical physicists. Anyway, cosmic consciousness is the state of consciousness that is actually timeless, spaceless, and limitless, no? In here, our intuition, the intuitive wisdom of the Supreme Being will come into play, above and beyond the mental faculty of knowledge that's given. If a patient has a belief system, it must always be recognized. No, there are things that we cannot understand. We have always to consider. That is only the implication. That means to say, as a human being, we cannot grasp everything 100%. We will not understand 100%, even though you have a IQ of 197, an IQ of 200, an IQ of 240, the highest possible IQ that you may actually have. You may not know about everything. You know the meaning of IQ, right? IQ is the measure of intelligence, right?
Yes.
But this is only a quantification, but there's no specific fact. But for the meantime, the normal IQ is 100. Very simple, no? How did a person come into this IQ? You see, a mental the mental age divided by chronological age times 100, that is 100. So if you're, for instance, very simple computation of IQ, you know, if you are 18-year-old, that is your chronological age, right? If you think like an 18-year-old, so therefore your mental age is 18-year-old divided by your chronological age, that's 1 times 100. Therefore, your IQ is 100. 18 divided by 18 is equal to 1 times 100 is 100. So the normal IQ is 100. That's the meaning of your intelligence quotient. Now, another one, of course, in relation to IQ, we'll discuss about this in intelligence, no? If you're an 18-year-old, but you think like a 10 years old, you see, 10 divided by 18 times 100, that means to say you have a low IQ, the IQ that is lower than 100. So that's actually the meaning of that. No, your chronological age is higher than your mental age. The mental age is actually the key in this aspect. That's the meaning of that one. Now, there is a limitation on everything. If you're going to look on the bus space, sometimes we cannot explain that because it's very wide. We attribute about what's going on around us on the things that we cannot understand. So if the patient will be actually believing that way, we have to respect them. That is the meaning. So sometimes they're always actually telling that there is a supreme being other than God. You know, there are many people like this, no? They do not have God, but they have supreme being who actually guides everything, but they refuse to call it a God. This is actually the difference between divine consciousness from cosmic consciousness. You see, there is something over and beyond, but they do not acknowledge that as God. In divine consciousness, everything is attributed to God. Everything is attributed to religious belief. So we have always recognized this. You know, there are so many possible patients who come to us all the time. Okay? So moving forward, let's proceed now into altered state of consciousness, no? So we are done with consciousness. Simply consciousness is our awareness or perception of something that's going on around us. In short, we will be using our different senses to look into what's going on, to look into what's happening around us. Now, to summarize that also, as nurses, we have to be very careful in looking into the state of consciousness of the person, particularly if the person is unconscious. We have to judge if the person is alive or not. How do we do that? By assessing them, by examining them, by looking into their state of unconsciousness by using Glasgow Coma Scale. The GCS, as we know of, or the so-called Glasgow Coma Scale, has a maximum mark of 15 and the lowest that's 33. Because if you're going to have 15, then you have no problem, you're fully conscious. But if you're going to have 3, you're almost dead. You could actually be dead, or you could only be in the state of coma. That is actually the importance. Now let's try to look into the altered state of consciousness, otherwise known as sleep. You see, if you're going to alter your consciousness, that means to say you are going to relax all the muscles. You are going to relax all the senses that would actually be basically stimulating you, or picking up the stimulation around you. That is actually the meaning that relaxation means to say temporary. So you are going to suspend temporarily the picking up of stimulation around you. That's the reason why it's called altered. We call it sleep. Sleep is very fundamental. Sleep is very essential need of a healthy person. Okay? That's the reason why 1/3 of our life is spent by sleeping, isn't it? Let me ask you, no? Sleep is very important. How many hours do we have every day? I'm going to let you be aware of what's actually going on around you. How many hours do we live every day? Do you know? In short, how many hours we have in a day? 24, right? How many hours?
Yes.
How many
22.
hours? Yeah, how many hours we are sleeping normally?
8 hours.
8. Therefore, 1/3 of our life is spent sleeping. I would like you to be aware about that. I would like you to realize about it. 1/3 of our life is spent in sleeping. In short, if we are 30 years old, we are spending 10 years in that 30 years by merely sleeping. And you know for a fact that if you're sleeping, nothing is actually going on around you, isn't it? Anyway, we're going to look into that as we go on. Our discussion is a little bit more interesting already, you know, because sleep is a little bit interesting topic, because this is one of the area of psychology and neurology that we have to study, right? Anyway, for your attendance for today, I would like you to write present in the message board, okay? And we will continue. Hopefully next meeting, that will be on Sunday, we'll finish this and we will start with sensation and perception. so that we can actually tackle a lot of topic. No, if you're going to look at your textbook, there are simply so many topics to be discussed. Okay, so can you do that already? Thank you for listening.